Hi guys, so if you're watching this right now, you are interested in knowing how my rhinoplasty went along with the cheek fat removal and what I have been doing for the past 2 weeks and what torture I've been enduring for the past 2 weeks. So follow along with me and let's go to Tijuana. Hey guys, so I am vlogging. This is about 12 hours out from my surgery. My appointment time is at 6 a.m. So it is now 6 p.m. and I'm gonna take as much sleep as I can and wake up at 12:30 a.m. Get my stuff ready, feed Bentley and Artie, wait for the sitter to come, and I will be headed to Tijuana. Okay, good morning guys. Right now it's 1:35 a.m. I'm already packed, ready to go. Ashley is gonna be on our way soon. Then we're gonna go pick up her dad and then head to Tijuana. As you can see, it's still night out. It's literally in the middle of the night. But yes, so we're gonna be on the road in a bit and I'll see you soon. So here you can see us driving through LA, headed to Tijuana. Me and Ashley headed out really early. Those right there, the lights that you see, is all of Mexico. This part right here is where they were telling me where, if you were to walk the border, this is where you would walk. And this is us driving through the border. It was kind of scary. And we're almost out. And there we go. And now we're successfully in Tijuana. So we are here. It's 5:30 a.m. I have until about 6 and here we go. For this part here, I'm getting dressed to go into surgery, and this goes really quick. As soon as I got down, they put the IV in, and this is me. And then surgery. This part I couldn't really talk because my neighbors next to me had, sat in their beds and I didn't want to disrupt them with my vlog. So, hey Ashley. This is some Jell-O and juice that they were trying to get me to eat after surgery. The fun stuff. So this part is gonna get a little gruesome all up in my face. My nose instantly started bleeding, you can see. And I tilted my head back because I was panicking. She's putting on the new gauze and yes. You have premonitions at this point. You don't dream. You have premonitions. Okay. Thank you. Thank you. So I just had my bandage re-taped to my face. Okay, so we just took the gauze out from my buccal fat. What the fuck? I'm so scared. Here we had to change out the gauze one more time because I bled out so much from the last one, and it was probably about like 20 minutes later. And here you can see me checking out my nose, freaking out a bit, panicking. Why is it so like... Thank you.
Es que como 3 horas de camino son.
This is me in the car trying not to throw up because there's a huge blood clot on the side of my mouth and trying not to die. Okay, so we just got back from Tijuana. There was a huge blood clot on this side that no one would ever tell you about, and I just like felt like throwing up the whole time because all I kept feeling was like this big jelly fucking blood-like taste in my mouth. I hate blood clots. I fucking hate it. But it was in my mouth for a while and I just like band up. When you're in the car, you have to buy your own gauzes. I just band up, grabbed one, and I stuck it on the side, held it there for 2 seconds, pulled it out, and this massive blood clot came out onto the gauze. So I'm going to set up my sleeping area here and just chill. I shouldn't even be talking, but anyways, also the meds, I don't even know what meds to take. It's all in Spanish, and there's no dosages on there. But anyways, enough talking. I'm gonna go lay down. I'm so fucking tired. Thank you, Lynn. I'm going to link down below Lynn, my dog and cat sitter. I literally cannot do anything unless she is there for me because she's the only one I trust, the only ones the kids like. So here I am. Okay, so good night for now. God damn. Okay, this is where I get really swollen. After, and I need to change out the gauze. So we're going to do that. Oh my god. So I've already pre-wrapped the gauze. This is what it looks like. But you want to line this up with your nostril so it catches the blood. And pull gently. Don't even apply pressure. Don't apply pressure, don't pull it, just tape it where it falls. Okay, back to bed I go. I am still on day 2, but I'm drinking pineapple juice and diluted a little bit with water. The swelling is really bad. There's a lot of pressure there. It's hard to swallow my saliva. Right now it's currently like about 5 p.m. I don't ever want to do this again. Good morning, it's 7 a.m. They have not left my side. Okay, so technically this is day 3. 1, 2, 3, yeah. Swelling has gone down. I feel a little bit better. I was sleepy, almost like at a 90-degree angle. It was like, I was sleeping like this. I decided to elevate myself a little lower and the swelling went down so much. I don't know why. But there is a broken blood vessel in that eye. But all in all, I feel a lot better. Yesterday, I felt like giving up. I was like, I'm just gonna take this shit off and blow my nose and get over this already. But here we are, day 3. Let's go. Okay, so we are on day 3. I still haven't showered myself, still haven't washed my hair. I just lightly wiped around my face. I just changed my gauze. Feeling a lot better today. I should not be walking around, but I need to make myself something to eat. So yes, this is where we are. The swelling has gone down. Bruising is gonna like take a toll on me right now. But yes, are on day 3. I'm gonna try eating macaroni and cheese. I also started drinking apple juice alongside with pineapple juice. So yeah, excuse the mess in the back, but I just pulled this out real quick because I'm gonna make some pureed pineapple, like a pineapple smoothie, kinda, just to kind of eat that for lunch today. Alright, so here we go. So pineapple smoothie. Yes. Alright guys, so I finally got my phone onto my yeah. Just wanted to show you guys all up close now. It's extremely hard to still eat. This is like towards the evening of day 3, and everything is still massively swollen. Like, it's so bad still. But yeah, we will see how it goes. Okay, good morning. This is day 4. I look crazy. I need to wash my hair. The bruises are finally settling in. Every time I think about, oh god, I have to eat something, it hurts. And it's very uncomfortable because I have those open wounds in my mouth. And I could only eat with a fork because, you know, a spoon's kind of like bent, so it takes a lot more to go into your mouth. So, yeah. I have all the stuff here. Some bananas for later, some soup, some more mac and cheese. But yeah, so far it seems to be rough. Whoever said this was easy fucking lied to me. I'm still changing my gauze, I want to say every few hours. I'm mostly bedridden, so like there's no gravity pulling it down. I'm just like elevated and just laying there. So I'm not talking, I'm not doing anything, so. Okay, I just want to check in real quick. I was able to shower. I laid down in my bathtub and washed my hair very, very carefully, making sure water doesn't get here. So I just kind of sprayed some dry shampoo where my roots are at the front. I changed my bandage, and now I'm gonna lay back in bed and put some frozen peas on it just to, you know, minimize the swelling a bit. All in all, today is a little bit better, but meow. It's not everything that everyone says it is. Like, it's not easy. It really isn't. My nose is still bleeding. I know that mine was a very extensive type of rhinoplasty. Meow. Meow. But yes, I just want to be able to breathe and move my face again. This I can handle. The buccal fat I can handle. The rhinoplasty I would not recommend. I had a pretty good canvas to work with, but I had no idea that they were going to cut the sides and kind of pinch in the nose a little bit. So that kind of freaked me out because I scar very, very easily. So I don't know how the turnout was going to be, and it's giving me anxiety, massive anxiety. But I'm just going to go day by day and just hope for the best. But this is day 4 in the afternoon, and I'm going to go lay in bed. Okay, so it's about 2 p.m. and I'm gonna eat some broccoli and cheese. It's super, super soft, so I'm gonna just try to swallow this whole. Okay, good morning. It is Friday, and it is been about 4 to 5 days now. Alexa, what's today? Alexa, what is today?
Today's Friday, December 11th.
So today's Friday, and I feel like a lot better. Out of fuck nowhere, I feel a lot better. I'm eating some leftover pasta. I'm still just swallowing it whole. I don't want to chew. Sorry for the really bad lighting in here, but I'm eating in my bedroom, where I've been living for the past like 4 or 5 days. But I feel a lot better today. My swelling isn't as bad. It's gone down so much. It's so Weird, but these guys right here are still swollen by a lot. I was able to clean off some of the dry blood, like on the sides of my nose where they cut. Everything just feels a lot better today. I'm just up and about now, and so I'm gonna eat breakfast. I've already cleaned my gauze and changed it, and then I'm gonna rinse my mouth after I eat, and then probably just like chill here because there is nowhere to go because we're in the middle of a pandemic. But yeah, today is such a weird day. Yesterday, I swear I could have felt like I was still dying. Yesterday, I felt like I was so tired, about to give up. Today was pretty easy. I think you hit a point where you're just like, all right, I gotta continue to do this. Like I gotta keep pushing. I just wanted to update you guys. My bruising has turned yellow, which is a very good sign. That means my bruises are healing. I already changed my gauze, and I just wanted to give you guys a couple of tips and stuff. I wish I knew all of this prior to getting a rhinoplasty, but I did a lot of research, obviously, because you have a lot of time. Get hydrogen peroxide. Get hydrogen peroxide. A few days after, I would say, after it starts scabbing up, kind of start using the hydrogen peroxide with a lot of Q-tips. Dear God, you're gonna use. I used a whole 500 pack already. It's only like day 5. You're gonna clean around the edges to get that crust off slowly and gently. Just let it come off kind of natural. Kind of soak it with the hydrogen peroxide and clean it up. You're gonna need so many fucking Q-tips and cotton rounds. Okay, cotton rounds are gonna save your life to kind of just pat that excess like drainage that's gonna come out. You are going to need lots of gauzes. I thought it was gonna come with, you know, your surgery like packet thing like that you come home with. You have to buy them separately. It's really cheap at Tijuana. Like I got 4 boxes and 4 rolls of tape for like $8. Yeah, and then I came back here and I was like, shit, I need to order more. I got 1 box for like $12. So make sure you load up on that when you're there in Tijuana, because it's like what, $1 something a box, and it comes with like 10 gauzes. And another trick, just use one gauze to roll it out, because you have to change it every few hours anyway. Maybe the first couple of days, use 2 or 3 gauzes rolled up into one of these. I found that this way was easier to roll the gauze up, because this used to have the tape in the middle. Yes, it saves you more tape, but it doesn't absorb as much because there's tape right here. Also, I am still currently changing my gauze maybe 4 or 5 times a day. And the bleeding has gone down significantly. 3 more days till I get the cast off. I'll be heading back to Tijuana to get this removed. And no, I still cannot breathe through my nose. I'm still on a soft food diet. I'm still icing this area here because it's super swollen. But yeah. Good morning. It is Saturday, so technically day 5 of getting my rhinoplasty, and we're cleaning out the bandage again because I woke up and it was dripping wet with, you know, drainage and blood. Another trick is that if you're gonna put your hair up, get a clip. Don't tie it because it pulls your hair and it pulls your face. So also you're gonna need lots of bottled water to clean. You don't want to use sink water, which was my first couple days mistake. I was freaking out because my girlfriend was like, don't use sink water because the sink has bacteria, and I was like, oh my God. So now I'm panicking, and right now I'm just using the Q-tips to get the extra drainage out. And you just want to go in there slowly, like very lightly, and just kind of twirl gently. And as you see, my nose is still bleeding. I don't know if I'm supposed to be doing this. Again, I wasn't told anything, but I saw this on YouTube. One of the girls were doing it. And I started using hydrogen peroxide. I don't know if I mentioned that yesterday, but we are just going to slowly get all that out. Those are blood clots in there. or if there's something in there to block it. Because when I asked the surgeon, is there anything inside my nose, and he said no. So I'm a little freaked out by it. Just not gonna say anything. Countdown is 3 more days until I go get my thing off, and I feel like I should panic because it's nothing like anybody else's process where, you know, they're all great and they're not bleeding, they don't have to use drainage, and they go to see their doctor and they just take off the split and it's like perfectly clean, there's no dry blood. I'm freaking out. Using hydrogen peroxide very gently on the edges, I still can't get the blood out. It's just gonna affect the scarring. Like, I don't understand what I'm supposed to be doing. And when I do DM them, they're very slow on responding. So, yeah, I'm just going on this edge here. I don't want to go too far up because I don't know. I think there's something in there. It's either that or just a massive ass blood clot. I don't know. Real quickly, I want to show you how I wrapped the gauze. Like, so you just roll it up like you would, and then you take the edges around, and then you're gonna measure. I always put things on top of the sterile thing just because I want to be clean. And then you're gonna measure your tape over the gauze to see how much you want tape exposed on your cheek. And it's gonna be about here. And then you just center it, and it comes out like that once you stick it on the thing. Okay. And then you're going to, I'm sorry, I'm like looking in the mirror. And then you're going to carefully wrap it around your nose and then pin it down on your cheek. Don't pull anything, just make sure it's resting on your nose. Just like that. And then you successfully changed your gauze. And I had to learn this myself. But it's so irritating having this on your face. It's like having your period on your nose. Like, it's constantly bleeding and you can feel it when it comes out. It's just, I know that's very gruesome, but this is the hard truth. I just can't wait to take this shit off. Like, I'm like so over it. Like, at the 2nd to 3rd day mark, I was like, I'm gonna rip it off. I'm gonna take it off, blow my nose, let it heal. However, I'm done. I can't do this shit. And it constantly just feels like you're drowning. You're just on your period in your nose. Hi, Artie. Okay, so this is gonna be my breakfast. Ignore those. I'm waiting to eat those. But my best friend came last night and dropped off these Jamba Juice quick smoothies. And don't come for me for my motherfucking straw, okay? I just had fucking surgery. You think I have time to clean metal straws and fucking have paper straws soaking in my fucking cups next to my nightstand? Shut up. Don't even come for me. I need something convenient to throw away, sanitary, and just use it. Anyways, this is my breakfast. I still can't taste it, but it's gonna be good for me. So, yeah. Alright guys, it's about 10 a.m. I'm about to take another antibiotic, and right now I am having naan bread and some hummus. Let me just show you how I am eating it right now. It sucks. I have to break off a piece of the naan bread, like a very small one. I look crusty as fuck, y'all. Like, oh my god, I can't believe I'm gonna post this. But can you take a little hummus? And pretty much fucking swallow it whole because you can't fucking chew. What I would do for a slice of pizza, for a fucking burger, motherfucking salad. And I never say that, okay? I would eat a motherfucking salad. Anything that I could just chew and doesn't feel like baby food in my mouth. But anyways, I just wanted to show you what I was having for lunch. Good morning, guys. It is Sunday and this is gonna be day 6. So the yellowing is more prominent today. I still have the bruises on the eyes. Now my lips, I had it up to here with the whole breathing through the mouth and my mouth being so chapped and dry. There were chunks of skin on top of my lips and it was making my lips so tight and like I couldn't like move it. I just picked it. I'm sorry. I have anxiety. I was just like, I can't do this. I had to fidget and I was just picking and then they bled. So that's why my lips look like this, okay? I couldn't get to the top one without compromising me moving my nose, so I did not want to touch the top. As you can see how like this one's kind of like plumped back out and it's kind of like movable, versus this one it's like, so there, that's why my lips look like this. Plus 2 more days, I just need 2 more days. I'm almost there, guys. I'm almost there. So real quickly, there is one of my nostrils, it kind of alternates. I can breathe 10%. Like I can get a little air through it. Sometimes I do it, sometimes like starting last night, it just like opened up a little bit. So I'm a little weirded out by it, so I'm just like still not trying to breathe through it, but I can kind of breathe 10% out of one nostril, so progress. Okay, I got a really weird update for you guys. It's Sunday night and it's 2 days away from getting my cast off. If you can tell, I'm talking almost normal. I was eating some soup and my nose started to run a little bit, so I sniffed backwards and this big, massive thing came out of my nose. I wouldn't say it was a blood clot. It almost looked like a very long rectangle jelly. Good morning. It is Monday, day 6, 7. I don't know if you count the same day as one day, but I got my surgery done Monday and today is Monday. I get my cast off tomorrow. The good news, and weirdly enough, like last night, I was able to breathe through both of my nostrils. It was just like, hey, you can breathe now. So I'm just waking up, so I look even crustier than ever. But here we are. It's so gross. I just want to scrub and blow my nose. But we have one more day. The pain is very minimal. My nose just feels very dry inside. Like I just want to pick it or like kind of do a sinus rinse with it. Obviously I can't wet the area. So this is what's going on. So tomorrow, I'm going to Tijuana again to get my cast removed. So it should be fairly easy. Okay, real quick, this is gonna be a little TMI, but it slid to the back of my throat and I gently spit it out. Is this important? Is this important? Because this is definitely not a booger. It was a snot. It's kind of semi-hard and I'm kind of scared that it might be part of my cartilage. It's like 1 day before I'm supposed to get my splint removed from the cast and I'm freaking the fuck out. This is me showing you raw and everything that goes on during your rhinoplasty. Like, it's not even a booger consistency. It's kind of hard. So I started freaking out last night and I don't know what to do. I just put it in a Ziploc bag on a cotton round, but as you can see, it's not a booger. It doesn't move around. It's just there. I didn't do anything. I didn't blow my nose. Nothing can get through these holes, okay? I just was laying and then I was like, okay, I'm just gonna try and like spit something out because I can feel it. So I gently, and something just went through and I was like, "Ugh." So I spit it into my sink and before it went down, I was like, what is that? I kind of caught it. Yes, I did. I caught it with my hands and I put it on a cotton round and this is what it is. Does this look important? This looks very important. Hi guys, okay, so it's Monday at like around 6 p.m. I decided to put this back on just because I can't stand looking at my scabs and my whatever, but I just showered. And if you notice I'm in the same few PJs, it's because it's to limit the work that I have to do around the apartment. So I'm washing and drying the same few outfits that I'm wearing throughout the day. But I've mainly been at home anyways. So tomorrow I am going to Tijuana and it is going to be at 9 a.m. So that means I have to leave here in LA at 6 a.m. and I have to cross the border and everything. So I'm calling it an early night and I'm gonna go to sleep soon, so I just wanted to give you a quick look before I take this bitch off. I can't even raise my brows. Good morning, guys. What time is it?
4:25.
It's 4:25. We're about to head out to Tijuana. Say hi to Amy.
Hello.
And we're gonna head out and get this shit off my fucking nose.
Finally.
Okay, so for this part, we're removing my cast. Yes, it hurt. I saw a lot of YouTube videos where they roll a Q-tip underneath it. For this, we just yanked him off with a pair of tweezers. Youch. And it's still swollen, yeah?
Oh, yes.
Okay.
At least you need to wait around 3 months.
3 months?
Yeah.
Okay.
So right now, I'm going to remove all the stitches.
Okay. I'd like to apologize in advance for all the mouth breathing that I had to do this entire video, the entire vlog. I couldn't use my nose, so I was just breathing through my mouth. Switch hands. Here we're taking a few more stitches off, and yes, this part does hurt too. He takes tweezers and then snips them, so it kind of tugs at your sensitive nose. But I just want to put something out there. With all those videos online, how do girls look so happy with the results when they take the cast off? Like, you know this shit's so swollen, right? And it comes out looking like this, exactly like this. Hi guys. Okay, so I just got back from Tijuana at about like 1:30. It is now 3 o'clock. I had to clean up the apartment and just shower and bathe actually. So this is the first proper shower that I've had in so long, and this is a shirt straight from the dryer, so don't mind the wrinkles. So let's talk about this visit. So we got the cast off, obviously. As for the nose, we took all the stitches off. You can see that it's yellowing here because he put some, like, I don't know, disinfectant-ish type stuff. Like the stuff that they put right before they operate, I guess. So maybe it disinfects. But this is the nose with the cast or mini cast tape, whatever you want to call it, on. So it has been a rough 8 days. Okay, so all in all, I think the nose is pretty cute. I just am worried. This is me telling the truth. I'm worried that this is too pointy. Like, it's cute, but it doesn't fit my face. So I'm hoping that in the next couple of weeks it settles, kind of relaxes a little bit, because I feel like my nose is a little too pinched. I know you guys are gonna agree, because it really just looks like, you know what I mean? I wouldn't say I'm not happy with it, but I'm saying that I'm panicking just a little. My anxiety is skyrocketing. I'm just kind of panicking just a little bit. Then again, it's only been 8 days since my rhinoplasty. But one thing I will say is that my nostrils are uneven. They are now even. Again, I'm hoping it's something that will fix itself. So as you can see, this nostril is kind of going this way and this one is going up. But yeah. So again, not saying it's a bad rhinoplasty, but we're just hoping things kind of like fall into place. Oh my God, it felt so nice to fucking shower. You guys have no idea. As for my nose, let me let you hear it. It's still a little congested, but we will see. I will check in on you guys tomorrow, obviously, or like, since the cast is off and it's kind of just like subsiding and kind of like settling in, I'll probably check in like every few days. It's time for me to get back to work and do normal things again. I don't know if I'm allowed to, but a bitch gotta fucking pay for her bills. This apartment doesn't pay for itself. So I'm getting back to work. Hi guys, so today is Thursday. I also have a pimple patch right here, but yeah, I'm starting to like it. It's growing on me. Stupid ass. It's just it freaks me the fuck out when I first got it. So now that the stitches are off and the scabbing is starting to go away, let me just focus in on that real quick. It has been stressful, so I still use like the little bandage underneath because I'm working on clients. So I have that on and I have my face mask on. So yeah, decided to do my hair a little bit, fluffed out my brows, a little liner, lipstick, barely any mascara. So just wanted to see what it would look like. And I am teaching a lash class today with Ashley. So I am going in like this. There's only a couple more days until I take the tape off. So yeah, the next clip would be me without the tape and my final nose reveal. Good morning guys. Right now it is like 7:20 a.m. If you made it this far, it's about 2 weeks post-op rhinoplasty and buccal fat removal. It's been fucking 2 weeks and I'm gonna reveal my nose now. And yes, this is me peeling my lip. I really have an issue with anxiety, and you guys seen it throughout the entire like vlog that I've been picking at my lips. Here we go. I'm gonna take this guy off first. Okay. This is so gross. Like imagine sitting in this shit all the time and not being able to scrub your fucking nose and the pores on your nose. And it's still extremely swollen. So this is not the final thoughts, but it's the nose reveal, I guess. But my lip's bleeding. I was kind of scrubbing it, but it slopes perfectly. And I have like that Tinkerbell tip. I was really scared about the scarring. This is really close to my face. I was really scared about the scarring because, as you guys know, I had a keloid. I scar very easily, but this was the main reason why I had anxiety, was because I was scared that the scarring was not gonna heal. This is like one of the stitches here, one of them here, but they took them out already. This one is kind of raised. I don't know why. It is almost perfect, obviously, because I'm still a little swollen. But I'm gonna rewatch the beginning of this vlog when I edit it, and I'm like, I was such a baby, I was such a brat. I was going through it. I was panicking.
Bitch, you
no
still
one
going through
tells
it.
you that when you get your rhinoplasty that you are going to look like a pig. It's gonna be so turned up and you're gonna be like, oh my God, is that my nose? Nobody tells you that. Nobody tells you that, you know, it's gonna be a scary healing process. I really thought I was gonna have a pig nose. Like I was like, oh my God, it's way too hot. So that is going to conclude my rhinoplasty in Tijuana vlog, my first vlog. Anyway, so if you want to, you know, follow up on me and like see how the progress is doing, I'll be posting back on my Instagram now. But yes, that's my nose. Bye. So I decided to put makeup on just so I don't completely look like shit, because I have been the entire fucking vlog. And here it is with makeup. It's still swollen, it's still kind of bulbous here, but this is what we are working with. As for the cheeks, I feel like it's still a little swollen. I mean, I just got out of surgery about 2 weeks ago, so I am waiting for more swelling to go down and for everything to settle in. But ew, my baby hair. the long wait is over. Here it is, guys, and let me just give you a little background there of my nose. So again, this area is still super swollen, but as for breathing, it's still kind of hard to breathe. There was a lot of things that happened in Tijuana that I wasn't too happy about, like the bedside manner, just their customer service, how they deal with things. I was completely lost the entire time. If you have any questions about going to Tijuana for this specific procedure, if you're planning to go to the same place that I went to, feel free to DM me. I'll try to get back to everybody as soon as I can. But yes, this is my new news. So anyways, thank you so much for watching, and I'm sorry if a lot of it was very graphic and up close and you had to see me like that, but definitely would not want to go through that again. I'll catch you guys later, and thank you for everyone that's been supportive of my journey and checking in on me and making sure I was all right. And for those of you bashing people who wants to get anything done to themselves, fuck you.